here at Wegerif. I'm a double board certified plastic and reconstructive surgeon with a focus on aesthetic surgery of the breast and body. So today we're going to be going over something that's been getting a little bit more traction recently, and it's actually talking about removing breast implants. So there's a multitude of reasons why someone may want to remove breast implants. If you're a younger person, you may have decided it just wasn't for you. You don't like the look of it anymore, or you don't like the extra weight. For someone that's had implants for a long time, you may feel that you're going to be undergoing a surgery to do a breast lift or something else, and you just don't want to have to worry about replacing implants again at some other point in the future, so we can remove them. You may have had an issue like a capsular contracture that's not been resolved with repeat surgeries or different interventions, and you just want to get rid of your implants altogether. So plenty of reasons for it to happen nowadays. I'm a big proponent of breast implants. If you want to get a breast augmentation, I think they're perfectly safe for the majority of patients, but there's some people that just like to have them removed for whatever reason. So when we're thinking about that, we have to talk about the different things we have to think about in order to get you the best result that you're looking for with removal of breast implants. So if you're a young, healthy person and you had a breast augmentation, you didn't need a lift, and you're still young and your breasts don't need a lift at this point, we can just remove the implants. And you often don't have to do anything else. So we can go in through the same incision that you originally had the implants placed through, remove them, and your body tends to retract pretty well, especially if you're on the younger side, say less than 30, 35 years old. If you're a little bit older, you've had your implants for a long time, or you need a breast lift, we can do two things. We can either do a staged approach where we remove your implants and we see how your body reacts to it and how much your tissues contract. And if you're happy with the look of just doing that, we don't have to do anything else. We can always go back later and do a secondary breast lift if you don't like how things settled out after we've given your body a chance to heal. Or we can just remove the implants and we can do a breast lift at the same time and kind of do them all in one combined procedure. So whenever we talk about removing implants, there's one topic that gets a little bit of controversy within the plastic surgery community, even within different plastic surgeons, and that's what do you do with the capsule? And the capsule is your body's scar tissue that forms around an implant. This always happens with an implant, and it's perfectly normal. Typically that capsule is nice and thin and soft. Becomes a problem when it turns into a capsular contracture, and that's when the capsule gets thicker and harder, and it can deform the shape of the breast implant. And then the question is, what do we do with that capsule? How aggressive do you need it to be? If you have a normal capsule and we're just removing the breast implants, you really don't need to do anything to the capsule, okay? There's been a lot of studies and research looking into this. We can just remove the implants and that takes care of any issues. If you have a thick capsular contracture, we may want to remove some of that capsule at the same time so that it's not affecting the shape of your breast at all, because sometimes it can be thick enough that it can actually deform the shape of your breast a little bit. But like I was saying, there's a lot of research that went into what to do, and there's something called breast implant illness, which is a very uncommon thing, but something that can happen, and that's when somebody has a poorly defined constellation of symptoms, usually related to fatigue, pain, just different issues that we can't identify a medical reason for, and that's another reason to remove breast implants. And so a lot of people thought, like, well, you need to remove the capsule if you're doing it for that purpose. And then they did a study looking at it. They looked at a bunch of different lab values to identify if there's anything that we can physically see with data that changes with removal of the implant alone, removal of part of the capsule, or removal of that entire capsule altogether. And there was no difference between those three groups. So I'm in the school of thought that you don't need to be super aggressive about removing all the capsule. That opens us up to some other issues that may happen, like bleeding, hematoma, seroma, because we're just dissecting more tissue. It often also involves a little bit of a larger incision than what you had for just a breast augmentation to be able to completely remove that capsule. But if it's something you feel strongly about, I'm happy to do that, and I have done it many times for issues like capsule for capsular contracture, and we can do what's called an M-block capsulectomy, where we remove all of the capsule. But again, I typically have to extend that incision a little bit so I can get all the way around that and remove that capsule with the implants. So I know this is kind of a hot topic, and we may have some questions out there, so let's see what we got.
All right, first question. How do I know if I need just an implant or an implant and a lift?
All right, so that's a common question we get, and that really depends on where your nipple position is in relationship to the fold of your breast. So if your nipple is at or below the fold of your breast, then you probably need a lift at the same time. That's one of the easiest ways to tell.
Next. Hi, doctor. I noticed you brought up breast implant illness. How do you know if you have it?
So breast implant illness is a diagnosis of exclusion, meaning we have to rule out all the other medical reasons why you could be having some of the symptoms you're experiencing. So if you have fatigue, we need to check your thyroid levels, we need to check your hormone levels. And if all those things come back completely normal, and when you've had your breast implants and that's the only thing that's changed, then we may say that could be breast implant illness. We can't guarantee that whatever symptoms you're experiencing are going to get better with removal of the breast implants. But oftentimes people say that those symptoms did get better when their implants were removed for patients that think they have breast implant illness. Again, this is kind of a hot topic that people have different opinions on, and some people feel very strongly about. And so I never like to discount what a patient has experienced, but I think it's a little over-reported. And one of the things I always say to people, we start to get more fatigue, more aches and pains and different things as we get older. And typically the people that are talking about breast implant illness have had their breast implants for a number of years, and they've also aged during that time. So it's, it's hard to put a single finger on what that is, but if we've ruled out all medical reasons, that's the next step, is to remove breast implants.
Thank you. Hi, doctor. I'm in my 40s. I've had implants for over 15 years. I don't like the way they look now. What do I do?
Again, come see me, fill out a consultation, we can talk about your options. If the implants were on the smaller side and you don't need a lift, we could just remove them and your breast tissue will return somewhat to the shape they were beforehand. If not, we may need to do a lift at the same time.
Do you do liposuction in the armpit when you have a breast lift?
Not all the time, but I often do. It depends patient to patient to see if you need it or not.
Okay, we have this a couple times, all right. Okay, do you put the implants in through the armpit or under the fold?
So there's three main places incisions that people use to place breast implants. One is transaxillary, one is around the areola, and then one is in the inframammary fold. There's clear data showing that the inframammary fold has the lowest capsular contracture rate, so that is the place I always choose to place implants through.
Hi, doctor. I got breast implants over a year ago, and one looks different than the other. What do I do?
It could be a few different things. It could be just how your implant settled. You may have needed to do some massage or use a band during the recovery process to help them settle evenly. It's something I always tell my patients. We need to keep a close eye the first few weeks after surgery to make sure both implants settle evenly, because there's interventions that we can do. It's also possible you may be developing a capsular contracture, which can cause the shape of the breast to change with time. So go talk to your plastic surgeon or come see me.
Do you lose nipple sensation after a breast augmentation?
It's possible you can have a change in sensation. I think it's exceedingly rare that you would lose all sensation, but it is possible to have a change in sensation. Most people, it goes back to a point where they don't really notice the change.
Let's see. Can I breastfeed if I have implants?
Absolutely. So we're not cutting through any of your ducts. All the mechanics are still there. So I always tell people it shouldn't affect your ability to breastfeed.
How do I know what size implants I need?
That's based off of what your goals are, and then the measurements that we take when we meet you. The most important measurement is the breast width. We need to find a breast implant that fits your native breast width, and then you choose different profiles, which means different volume for that same width based off of what your goals are.
Thank you. Because I don't want to wake up with breasts too large or too small.
Yes.
I got capsular contraction.
Contracture?
Contracture, yeah. Do I have to have them removed?
So No, if it's not bothering you, we have different levels of capsular contracture. If you are happy with the way they look and it's not bothering you or it's not painful, you don't have to do anything. We can just let it ride and you can watch it, and the next time you need to replace your implants, we can do that. If it's bothering you or if it's changed the shape of your breast and you don't like how it looks, there's a few things we can do. Sometimes similar to what we talked about, removing part of the implant, washing things out really well, placing a new implant. We always tell people if you develop a capsular contracture once, the risk of it happening again is a little higher, so you just need to be aware of that as well.
Hi, doctor. I recently inquired with Dr. Earl. I don't believe that he does fat transfer to the breast. Do you perform fat transfer to the breast?
I do fat transfer to the breast, yes. Would be happy to help you. And that's another adjunct that we can use if you want to remove your breast implants and you still want to restore some volumes. We can do fat grafting to the breast. You need to keep in mind that it often takes more than one round of fat grafting to get the desired size that you want, because we can only transfer so much at a time for the breast.
Yes, because she says she doesn't have implants, but she just wants a little fuller up top.
Okay. Come talk to me. I would be happy to help you.
Perfect. All right. Let's see. Will a lipo tighten the arms, or do I have to get an arm lift?
So the skin in our arms does not tighten very much with liposuction alone. We have another tool that we use to help encourage the skin to tighten. That's something called Body Tighten, that uses radio frequency energy to help heat up the soft tissue underneath the skin and causes it to contract. Now, that's good for moderate skin contraction. If you have a lot of loose skin, you probably need a brachioplasty, which is the incision on the inside of the arm.
Thank you. Okay, all right. Hi, doctor. I've had my implants for over 22 years. Is it time to get them exchanged?
It probably is. You should go speak to your plastic surgeon or come talk to me. But most breast implants are guaranteed for about 10 years. Doesn't mean you need to just arbitrarily change them at that point, but you should start thinking about it if they've been in for over 15 or 20 years, because at some point they're prone to rupture the older they are, so we should do that before they rupture.
Let's see, got a few more. This is similar. Hi, doctor. Are the new implants, do they have a lifespan?
Yeah, and so different companies, I believe Sientra is the one with the longest warranty. I believe theirs is 20 years. Allergan and Mentor, I believe, are 10 years, and I have to double check what Motiva is, but I think it's also 10 years. But, in reality, the newer generation of breast implants have improved materials each new generation, and so they're continuing to last longer and longer, but you should still consider exchanging them at some point.
What treatment can I do to help scarring on a skin graft above my lip?
Scarring. So those are always kind of tough areas. The big thing you want to do, because grafted skin typically does not have the oil glands, you need to keep it moisturized all the time to help it from getting dry and flaky. Stay out of the sun. You can use silicone tapes if you need to.
I had a tummy tuck 2 years ago, and I hate my tummy tuck scar. Are you able to do a revision?
Yes, we are able to do a revision. I would want to see the scar, because sometimes people have unrealistic expectations of what a nice scar looks like. But if it does look like it is hypertrophic or widened, which can happen when someone tightens it too much, we can revise it, no problem.
My aunt's implants ruptured. She was hospitalized for many months. Is that something that's common?
That's not common at all, and there's a lot of people walking around with ruptured implants right now that probably don't even know it. And most of the time when that happens, we just exchange the implants and we clean out the pocket. So I'm not exactly sure what her circumstances were, but that's not normal.
Okay, I know you got to go soon, so let's just hit a couple more questions. Hi, doctor. If I just wanted my implants through the nipple, can you do that?
I can do that, but I hate doing that for the reason that I stated. It increases the risk of capsular contracture. It's also cutting through more of your milk ducts when we do that through the nipple. So I prefer to do them for memory fold, but if you really want to, we can talk about the pros and cons of it, and I will do it occasionally.
All right, thank you everybody for the last question. I've been thinking about a breast lift for a long time. I've had a few consultations. I'm afraid because I've seen people who have lost nipples. Is that something that's common?
It is something that is possible. I would say it's exceedingly rare. It's less than 1% of the cases where that happens, and typically even if there's some type of skin necrosis, it's usually only partial and not complete, but something you need to talk to your surgeon about.
All right, thank you.
All right, thank you everybody. Please tune in and pureplasticsurgery.com to come check us out.
And goodbye.